Good morning, Dr. Jaffe. Thank you for being with us today.
Thanks for the invitation.
We have a customer that writes in and says her patient has chronically elevated ASO and arthritis. Attempts have been made to clear the group A strep with oral and intranasal antibiotics, biofilm treatment, ozone, and silver. The practitioner has used another food and chemical sensitivity test before she switched over to the LRA BioLiza Act test. The patient also had some IgG testing done many years ago. She responded well to it, but still has an elevated ASO. The practitioner would like to hear from you how you would approach the chronically elevated ASO using the PIH products and services, please.
Yes, I'd be happy to. When you actually bring me back to an anecdote very early in my professional career, I'm at the Clinical Center of the National Institutes of Health, and my boss, Jim McLowery, the head of laboratory medicine, comes in and says, the director's son has a high ASO titer, antistreptolysin titer, and we have cultured the bad kind of strep, the one that's associated with rheumatic fever and endocarditis and all the things you want to avoid. So I said, what antibiotic are you going to use? He says, we're not going to treat him. I said, why are we not going to treat him? He says, we're not going to give antibiotics because we would select the most resistant organism. And we have been through this before. You end up with multiple fights with a pathogen, and the pathogen wins. Now, more importantly, the ASO itself is a memory antibody. So when we say you have an ASO titer, it says you had strep. You may have it now, but you did have it, and your immune system recognized it and responded. But the more important point is that external therapies, from antimicrobial to biofilm, etc., including antibiotics and anti-anything, any biocidal compound, will select for the most resistant, will not treat the cause, because the cause was a lack of healthy mucosal, that is surface, immunity. Now we really have three surfaces. We have the surface of our skin, then we have the surface from our mouth to our tush, that's our digestive mucosa, and then we have where we exchange air, our respiratory mucosa. Healthy people, even those with high ASO titers, but healthy people who have had their immune, neurohormonal, digestive, and detoxification systems rehabilitated the way we would recommend in the PIH Academy approach, the physiology before pharmacology, the nature, nurture, and wholeness, the approach that corrects deficits in the person, in the host, reduces hospitality to infection. And oh, by the way, when your innate immune system is really topped up, it'll come and eat up anything foreign or anything worn out and replace it either with the amino acids that are the broken down products that are fine for the body to use, so you can take in something foreign and harmful. But if you have a healthy innate immune system, it goes into a recycling center in their cells and comes out as building blocks that help the body. So we want to get over this notion that the pathogen, the outside organism, the bad bug, is the problem. In fact, when we have a pathogen, when we have a harmful bacteria or virus or prion or parasite or anything foreign that is growing, we're feeding it. And so since we do physiology before pharmacology, we want to know whether you are eating foods that you can digest, assimilate, and eliminate without immune burden. And here, unless you're psychic, you need the LRA tests and plan to rehabilitate, that is, restore, renew, and make resilient your immune defense and repair system. So we do apply this principle of physiology before pharmacology, especially to people who have had pharmacology with little, maybe lip service to physiology. Couple of examples. If you take any medication that alters stomach acid, or take any antibiotic or any antiparasitic or anything designed to attack and dissolve biofilms, which, by the way, are simply complex carbohydrates produced by certain organisms like Candida, only in hospitable people, only in people whose innate immune system is exhausted, has not been energized. They have too many anti-nutrients and not enough essential nutrients. These are people who are surviving, but they're in survival mode. And we want to get people back to elective protective mode so that the secretory IgA and the mucins, so that the opsonins and the defensins that are electively produced by energetic cells and people make the mucosal a barrier. When I was a child, the way they sold toothpaste was something called the Gardol shield, and they had a piece of plexiglass, and the bacteria would run into the plexiglass and be stopped by the Gardol shield. In a sense, a healthy mucosa is a protective shield against foreign invasion. However, the people who come to us as clients, the people who have symptoms, the people who are patients, very often have lost their elective protective mechanisms because they don't have enough of the good essential nutrients, and they're in survival mode, but they're not in elective protective mode. And the fundamental thing that we do on their behalf is show them how to restore your ability to protect, to defend, and to repair. Because remember, it's your immune defense and repair system. And yes, defense comes before repair, but you should be able to do the defense that your body needs during the day. And at night, when you get restorative sleep, you should be able to do renewal. So it's a complicated question that is usually misunderstood, even in most of the clinical microbiology discussions. The notion that if in your mouth or tonsils there is a bad strep organism only becomes a problem if you don't correct the host hospitality. If you use ascorbate based on the C cleanse, if you take the polyphenolics as we would guide, if you take the magnesium and choline citrate based on first morning urine pH, if you give enough of the essential required nutrients and reduce the anti-nutrients, reduce the persisting hormone disrupting pollutants and solvent residues and toxic metals and mold products and radioisotopes. And the good news, because I know that was kind of not the good news is that 80% of the anti-nutrients, 80% of the bad stuff can be, by choice, excluded. That is, prevented from getting into your environment by your choices. And we have a resource guide through the PIH Academy, through ELISAC Biotechnologies, through our laboratories and our clinical services that informs, inspires, and trains health professionals who want to apply physiology before pharmacology, which is what I would do in this kind of case.